Sige mamaya, search na lang tayo. Sige, tara na!
For oral meds, I found a video. It has pharmaceutical phase, pharmacokinetics, and pharmacodynamics.
For drugs taken orally or by mouth to reach systemic circulation, it first passes from the lumen of the digestive tract into the hepatic portal system. This system consists of capillary network that surrounds organs of the digestive tract such as the stomach and small intestines, as well as the hepatic portal vein which carries absorbed materials to the liver. After passing through the liver, the drug finally reaches the systemic circulation and can be distributed throughout the body to exert its desired action.
Talk about pharmacokinetics. The meaning of pharmacokinetics is that drugs move in order to achieve drug action. There are 4 processes in the body after administration of oral anti-cancer drugs, and they are usually defined by its absorption, distribution, metabolism, and elimination. This process is commonly referred to as ADME. First, we're going to talk about absorption. Once a drug is being administered in a body, drug absorption will begin and the process of transporting the drug from the site of administration to the systemic circulation. The most direct route of drug administration occurs via IV because drugs that are given by this route are said to have 100% bioavailability. In contrast, oral drugs are subject to absorption barriers because they are taken by PO or per orem. Oral drugs absorption is governed by absorption surface area, transit time through the gastrointestinal tract, blood flow to the site of absorption, gastric and intestinal acidity and subsequent acidity, and intestinal efflux and influx transport, and intestinal metabolism. The second one is the distribution. Following absorption of an oral anti-cancer drug, this drug will be distributed from the intravascular space to its target in the extravascular space. Most drugs bind to the plasma protein, such as the albumin. The amount of drug that moves freely to its target will depend on how much drug will bind to plasma protein because only the free fraction of drugs is pharmacologically active. Metabolism. In the metabolic process, uptake of drugs in the liver is mediated by either passive diffusion or active transport. Once in the liver, anti-cancer drugs undergo 2 phases, the phase 1 and phase 2 metabolic reactions. Phase 1 reactions result in the loss of pharmacological activity or the activation of inactive prodrugs, while phase 2 reactions result in usually inactive derivatives for excretion, in spite of the fact that this step is also needed to activate some prodrugs, such as tamoxifen and etc. The last but not the least is the excretion. The main route of drug excretion are the biliary tract in the liver and kidneys. And that's all, and thank you.
Pharmacokinetics of oral chemotherapeutic drugs. Absorption is the process by which the chemotherapy enters the blood circulation. Chemotherapeutic drugs that are taken orally are dissolved in the stomach but are only absorbed once they enter the intestines and are subject to absorption barriers in the gastrointestinal tract. Chemotherapeutic drugs first cross several membranes in order to reach malignant cells. These drugs cross the membranes by active transport, pinocytosis, passive diffusion, or facilitated passive diffusion. Distribution. In the case of oral kinase inhibitors, a drug distributes from the intravascular space to its target in the extravascular space. Most drugs bind to plasma proteins while the rest of the drugs or the free fraction of the drugs move towards its target. The drugs that move towards the target are the ones that are pharmacologically active. This action takes place across the interstitial space, endothelial blood vessel lining, epithelial membrane tight junctions, and through the aqueous pores. Metabolism of oral anti-cancer drugs takes place in the liver and is mediated by either passive diffusion or active transport. Once in the liver, anti-cancer drugs undergo phase 1 and phase 2 metabolic reactions. Phase 1 reactions result in the activation of inactive prodrugs. Phase 2, on the other hand, result in the excretion of inactive derivatives. Excretion. Oral drugs are excreted in the biliary tract and kidneys.
So, ayan, search na tayo. So, ito, may nakita ako. Ito, sa YouTube. Ito yung sa parentera, kasi di ba dalawa yun? Kapag iba yung sa parentera, kapag iba dito sa oral. Kapag sa oral, yung tatlong phase. Tapos kapag dun sa parentera, dalawa. So, unahin muna natin yung sa parentera. Ayan. Pharmacokinetics, pati pharmacodynamics. Yan ang panoorin natin.
Absorption talks about the movement of drug particles from gastrointestinal tract to body fluids. Since we are talking about chemotherapeutic agents which are administered intravenously, it will not pass through the GIT. The drug will directly go to the systemic circulation. In order for the medicine to reach the malignant cells, it must cross several semi-permeable membranes. Chemotherapeutic agents can cross the membranes by active transport, passive diffusion, facilitated diffusion, and pinocytosis. As absorption continues, the drug is gradually distributed via the blood circulation to the tissues and organs. A drug distributes from the intravascular space to its target in the extravascular space. Most drugs bind to plasma proteins. The amount of drug that can be distributed depends on how much free drug is available, since these free drugs are the ones that are distributed to the tissues and organs and are utilized by the body. In cancer patients, malnutrition and hepatic dysfunction due to liver metastasis commonly lead to hypoalbuminemia. For a highly bound drug, the same dose results in higher levels of unbound drug or free drug on a patient with hypoalbuminemia than in a patient with normal synthetic function.
Metabolism. Metabolism is the most crucial and complex step of drug disposition. Hepatic uptake of drugs is mediated by transporter proteins. Once in the liver, anti-cancer drugs undergo phase 1 and phase 2 reactions. Phase 1 reactions are oxidative or reductive reactions and result in the loss of pharmacological activity or the activation of inactive prodrugs. Phase 2 reactions conjugate phase 1 products to form usually inactive polar derivatives. Many of the genes that encode drug transporters and phase 1 and phase 2 enzymes are polymorphic. Excretion. The main routes of drug excretion are through the biliary tract and kidneys. Transport systems are involved in the biliary excretion of drugs, including the ATP binding transporters ABCB1, ABCC2, and ABCG2. ABCB1 is involved in the transport of amphipathic and lipid-soluble drugs, whereas ABCC2 is mainly involved in secretion of conjugated metabolites. The role of ABCG2 has not been fully categorized. Medications and disease processes affecting the liver can negatively affect these transport mechanisms and reduce biliary excretion of anti-cancer drugs. Cancer patients occupy the entire spectrum of hepatic function from unaffected to frank liver failure, and this invariably results in pharmacokinetic variability.
And now discussing on pharmacodynamics, the biochemical effects, the main objective of drug treatment. It should induce a metabolic perturbation in cancer cells that would selectively interfere with the biochemical program of the commitment to replication, which would result into the death of cancer cells. The host cells should adapt and recover from the toxicity brought about by the drug treatment. And now talk about the physiological effects. Drug treatment affects fast-growing normal cells like blood cells, cells in the GIT, cells in the reproductive system, and cells in the hair follicles. The common effects of these drugs to our body are fatigue, which is one of the most common side effects of chemotherapy. It may be the result of anemia or may be a result of a lot of energy being used by the body to recover from the effects of the drugs. Next is signs of infection. It may be experienced by a cancer patient because the body's capability to fight infections is greatly compromised due to the lowered number of white blood cells. Next is bruising and bleeding. Platelets are important for wound healing and blood clotting. The cancer patient is at risk of bruising and bleeding easily. Such side effects are nosebleeds, bleeding gums, blood in the urine or stool, and unusually heavy menstrual flow. May be experienced by the patient receiving chemotherapy. Next up is nausea and vomiting, which occurs when certain drugs stimulate an area of the brain called the chemoreceptor trigger zone. Also, the effects of some drugs on the fast growing cells in the lining of the stomach may also cause nausea and vomiting, and also diarrhea.
Drug mechanism of action. In general, anti-cancer drug can be divided into three main categories based on their mechanism of action. First is black nucleic acid, DNA and RNA biosynthesis. Second is directly destroy DNA and inhibit DNA reproduction. And last is interfere protein synthesis. For black nucleic acid, DNA and RNA biosynthesis, DNA building blocks are folic acid, heterocyclic bases, and nucleotides, which are made naturally into cell. All of these agents work to block the formation of nucleotides or deoxyribonucleotides, which is necessary for making DNA. When the nucleotides are blocked, DNA and RNA cannot be synthesized, thus the cell cannot replicate. For directly destroyed DNA inhibits DNA reproduction. These agents chemically damage DNA and RNA. They disrupt the replication of the DNA, so the new DNA or RNA does not code for anything useful. For interfere protein synthesis, mitotic spindles serve as a molecular railroads with north and south poles. So when the cells start to divide itself into two new cells, those spindles is very important because they help to split the new copied DNA during cell division. This anti-cancer drug disrupt the formation of these spindles and therefore interrupt cell division.
Oh, so that's how it works.
Oh,
Oo nga. Okay, ang galing. Okay, so may sasagot na pala